What drove you down that path?
Well, hello and a warm welcome to another video. Dr. Sil here, a junior doctor specializing in psychiatry in Australia. And today we're doing a reaction video to another special Books by Special Kids channel video. This video is titled Managing Schizophrenia as a New Mum, which is a very interesting field of psychiatry. And I've had, weirdly enough, in the last 2 weeks, a lot of exposure to what we call perinatal mental health. So mental health issues in the before, during, and after birth time in a woman's life. This video will be good to help either reflect on what I've been learning or maybe teach me something. As you will know, attachment and connecting with the baby is a very important part in a baby's life and in a mum's life, and mental illness can get in the way of a healthy attachment. And so it's very important to put a lot of resources, a lot of support in helping women who have just or are about to give birth. Anyway, that's enough of me chatting. Let's get into the video. Alright guys, so as you may know, I tend to pause the video very early in to start a bit of a mental state examination, which is something that psychiatry doctors do to kind of get a snapshot cross-sectionally of someone's mental state in time, and also try and describe their physical kind of state. Because, you know, if you have poor mental health, you might also have poor physical health, and evidence of neglect or poor self-care, and all these sorts of things can also link to how someone's mental health is going. And instead of starting the video and pausing it, I thought I would just start on the first frame, talk, and then we can start the video. So very quickly, what I'm seeing, you know, a young woman, she's obviously a mum based on the title of the video, tattoos, expressive fashion design. I've seen some psychiatrists describe this as like antisocial kind of fashion, you know, piercing the cheeks, spaces. I don't see it as antisocial. I see it as expressive of maybe atypical to the social norms. She's got a short haircut. She's got makeup on. Her kind of makeup is like eyebrows and the like. You know, it's all kind of put together. She's got a theme that makes sense, and that's important to note because someone with a manic episode might only do makeup on half their face. You know, they might have paint instead of makeup on their face. I've seen people use, you know, textures to do their makeup because they were in too much of a rush to find their brush. That rhymed. Anyway, let's begin the video.
So whenever I publish a video about hallucinations, inevitably there'll be some people who reach out and say, it's clear that they're seeing spirits and they need to go see this witch doctor.
Oh.
And can you talk about why that's problematic?
That is incredibly problematic because that's enabling behavior. Experiencing these hallucinations, it's not normal brain chemistry. I mean, some people will see it as an act of God, and if that's what you want to believe and that's what you feel is prudent to your own situation, that's fine. But to tell other people what to do with their own bodies and what to do with their health, I mean, that's only something a doctor should be doing. I had a teacher who...
Wow, what an interesting opening scene, I guess. It's such a sensible response. It's something I see all the time. There's these things, it was only in DSM-4, the previous kind of diagnostic manual that we used to reference symptoms, where there's these things called culture-bound syndromes, which is like how psychosis can manifest differently in different cultures. And although the prevalence of schizophrenia is 1% across the entire world, so no matter what country you're in, it's the same number of people in the population that will get schizophrenia, suggesting a very strong genetic kind of contribution. But the outcomes will be very different. And in fact, in a lot of developing countries, there are better outcomes than in a lot of developed countries. And that is a complex kind of discussion around drugs, around culture and psychosis and spirituality and religion, and all sorts of things come into play around the outcomes. But the thing around culture-bound syndromes and seeing the psychosis as maybe mystical or God or the devil or whatever it is actually we, as psychiatrists, depending on what they want to do, if they want to do an exorcism or whatever it is, the thinking is don't get in the way of that as long as they take the medicine, you know, because the evidence is pretty clear that you need to take medicines to get out of psychosis. There's no therapy that can pull you out of a psychotic episode. You do therapy once you are in a good mental state, and only medicine can kind of pull you out of psychosis. And sometimes not even medicine can pull you out of psychosis. Sometimes you need ECT, electroconvulsive therapy, and sometimes that doesn't even work and people have horrible outcomes. It's a really horrible disease, and I deal with it every day. So if you have any questions about it, put in the comments.
She believed that I was seeing spirits. And that perpetuated a nasty notion that I was seeing spirits instead of hallucinations.
And she actually vocalized that to you?
She did.
And that made you believe it?
Yes.
And what happened from there?
I could have gotten treatment had she noticed the signs. Had she been educated on schizophrenia, I could have gotten treatment a lot sooner and my life would be a lot different.
When did you first start to experience the symptoms of schizophrenia?
When I was a small child. I remember my first memory, a lot of my childhood memories are repressed due to trauma, but some of my first memories is when I was 4 years old and I started experiencing visual hallucinations and audio hallucinations. To be honest, truthful, and open, with my schizophrenia, Dorian is the only thing in this entire multiverse that I know is absolute. Because I made him and I physically felt him grow. So he is loved beyond.
I'm just going to pause there to go back on a point that was unique. Look, I'm not going to make any comments about her diagnosis and care, and you know, I don't know. This is all just speculation. But an interesting point to note is the complexity in complex trauma and schizophrenia diagnoses. You know, schizophrenia is a list of symptoms. It doesn't tell you how you got those symptoms. And in 10 to 50 years, we're going to have 10 different types of schizophrenia. I'm sure about it. There's going to be, you know, more genetic schizophrenias. There's going to be this brain circuit, that brain circuit, you know, and maybe everyone has their own schizophrenia. It doesn't really change the management that much at this point. But currently, we know that complex trauma, which is trauma, you know, that is recurring and in childhood, can look like schizophrenia a lot of the time. But the treatment is different. You know, medications can help, but really the treatment for complex trauma is hard, bloody work with a therapist. And the reason I'm bringing up this point is because schizophrenia symptoms, I mean, I've never heard of them starting at 4 years old. It's really a disorder that starts when the neural pruning kind of gets to a certain point around, you know, at the earliest 10, you know, 9 to 10 years old is very early. Usually it's 19, 20. And sometimes it's, I mean, the peak of incidence is usually 19, 20 years old. Later in life, there's other kind of psychotic illnesses like delusional disorder, which can look like schizophrenia as well. And I've never heard of schizophrenia start this young. It's very interesting. But, you know, I'm not saying anything about her diagnosis at all. I'm just saying this is a unique case.
Words, because he's the only thing that I know is real. When I have like bad episodes, like I know he's real because I made him and I felt him grow from like little atoms into a giant baby that I couldn't even get out of me.
I mean, another point with her, she, you know, with love, I'm saying this, but she looks quite thin, and so you need to ask her about neglect and evidence of her not eating. But you know, I'm sure she's a great mother, but. You've got to check, you know, if someone has a psychosis, she's currently doesn't seem to be in psychosis, but someone is psychotic and they're not eating because, you know, maybe the hunger drive or whatever the reason, it could be a delusion, could be anything. You got to be worried, you got to be aware that, you know, maybe they're not feeding if they're not eating, especially if you're depending on like breast milk, which requires a lot of caloric intake and a lot of water drinking and stuff for the mum to produce enough breast milk for a bub. These are the things you got to think about.
He center you when you are going through it?
Yeah, he does. Yeah. Because my first thought is about his well-being, and then my second thought is about my well-being for his well-being.
Nice.
Tell me about your earliest memories of schizophrenia impacting you.
Ooh, I remember being on the playground and nobody wanting to play with me because I would talk to myself, and I would really be talking to the voices and asking them to not talk to me in front of my friends, so nobody wanted to play with me. I remember looking out my window in New Jersey, in Rahway. We lived...
An interesting way to distinguish voices that are from a psychosis versus voices from a trauma is to ask, and you know, this is not 100%, this is just, you know, from my observations, but it's to ask the person, can I hear it? because if you are experiencing a psychosis and you're hearing the voices, they sound like they're coming from outside of your head. They sound like they're coming from the room. That's why people hear them coming through the walls, through the screens. They sound like they're outside of the ear, whereas trauma voices often sound like they're inside the brain. You don't have control over them, and they're just as distressing and they're just as horrible, but they come from kind of inside the brain, so you know that other people can't hear them. So that's a question that I kind of use sometimes.
Industrial area, and I saw like dinosaurs in my window, but it wasn't like your normal dinosaur. It was very terrifying.
So what do you do when you're a kid and you're 4 years old and you see a hallucination of a dinosaur?
I tried telling my mom, but she...
So I missed the first part of that, but important to note the difference between a hallucination, visual hallucination, and a visual illusion. So a visual hallucination is you see a dinosaur and there's nothing there. Like there's no external stimulus that is a dinosaur that you see. But a visual illusion, which can be more common in trauma, is you see an object. So let's just say there's this, this is a thing full of pens and it's in the corner of my vision. And it just, at the moment when I'm looking at you, it looks like a kind of a black blur with a bit of odd shapes to it, But an illusion would be me looking at it or seeing it in the corner of my eye and it taking a form of something that isn't there. So there's a real stimulus, there's a real sensory input, but my brain is having a perceptual disturbance, making it into an illusion, not a hallucination. And maybe I see it as a dinosaur or as the devil or whatever. I've had a lot of patients kind of describe different things in the room as different animals, or, the devil is very common. So that's the difference between hallucination and illusion.
Had her own issues. She
there's a
struggled
black
with
cat.
alcoholism. She also had schizophrenia as well. So I inherited it from her. And she was untreated. So there wasn't much support for me, to be honest. I had to go through it on my own. I kind of grew up not knowing what was happening to me, not knowing what was going on. I thought this was happening to everybody.
Look, sorry to pause so much. I just wanted to make the point that if you have a first-degree relative, your risk of inheriting schizophrenia is very high, much higher than the general population. So there's definitely a genetic contribution, but it isn't 100%. So identical twin studies, if one twin gets schizophrenia, the other doesn't always get schizophrenia. It's not 100%. So that's why there's this stress diathesis model where we believe that there's this risk, like the genes have a risk of schizophrenia, but it has to get activated by usually, psychosocial stresses, stresses in life and trauma and things like that. And that activates the genetic vulnerability, and then you get the disease. And from my experience, when you have a mother with schizophrenia and that issue in attachment, it's heartbreaking because they're not in the real world with their kids. So they're not attuning to the kid's needs. There's this natural thing that happens from a mother and a caregiver and their child, and they get attuned to what the child needs, why the child feels a certain way, and that really is helpful for that kid's development and their attachment style to depend on the outside world, to trust the outside world. And if the caregiver doesn't respond to a baby that's crying, then that baby who's crying for help will learn that crying for help doesn't receive positive outcomes and might get an avoidant attachment style, or worse yet, a disorganized attachment style where they don't know how to maintain a relationship. And that's a big risk factor for the development of a borderline personality kind of character or profile. So anyway, let's keep going.
And I thought this was a pretty normal thing for everybody to experience, so I never knew there was something different about me. I was alone in the house a lot, so I just experienced so many hallucinations, so many voices and so many sounds, and I just kind of made friends with them. Like, I put stuffed animals to the voices I was hearing, and I thought that was normal. And, nobody could tell me any different, so I just accepted not having friends. Yeah. It wasn't until I started seeing a psychiatrist regularly that I figured out that I had schizophrenia, and that was probably about 2015.
How old were you at that point?
I think turning 25.
I'm sorry to pause, but this baby is so cute. I don't know if you guys are watching him just like Like he's obviously some interesting observations about him is he's not like he's not too clingy to mum right now, and there's a stranger in the room. So that's a pretty good, like you can tell this bub is a pretty confident little guy, and he's not like overly anxious and fixed staring. Like he's just smiling, bubbling away, doing his thing, looking at the interviewer, minding his business. This is, I'm not making a psychiatric assessment on the baby. I'm just saying he looks like a cute guy that's doing all right.
Up until 25, you just thought these hallucinations were something that everyone experienced?
Yeah. Yeah. It wasn't until my 20s that I really started reading and talking to other people and experiencing things that nobody else was experiencing in a public manner.
What do you mean?
Like the paranoia, thinking that people can hear your thoughts, thinking that people are plotting against you because they can hear your thoughts, or thinking that people who aren't even like remotely related to you or friends with you, who are just laughing in the background, that they're laughing at you. I started like talking about that a little bit. I was like, they're laughing at me, and everybody was like, what makes you think that? Why would you think that? There's no...
Wow, interesting. So, they used to distinguish schizophrenia as like hebephrenic schizophrenia or paranoid schizophrenia. Lots of different types of schizophrenia. We don't do that so much anymore, but this really is characteristic of a paranoid schizophrenia. And that's the worst one really to have. It just sucks. You just, paranoia is a horrible feeling. You can never not be anxious. You're just always worried that people are talking, thinking, acting. And she described another first-rank symptom. As a side note, first-rank symptoms are like the different symptoms of psychosis that are traditionally seen in a really clear-cut picture of someone with schizophrenia. And one of them she explained is thought, like broadcasting, or thought insertion, or thought withdrawal. Those are the three kind of thought manipulation symptoms. And so, people will talk about how they feel people putting ideas in their head, or taking ideas out of their head, or reading their thoughts. And that can lead to that can lead to all sorts of problems.
Give them any source to laugh at you about. And I was just so convinced, and then I started realizing, I'm scaring my friends. The more vocal I am, I'm scaring my friends. So that's when I started realizing maybe I am different.
What is it like to be a mom with schizophrenia?
Ooh. It's a lot of fun. Being a mom and living with schizophrenia is challenging, but I just started a new medication. I don't know if you want me to say the medication name.
If you're comfortable.
Yeah, I just started Lexapro. I started at 5 milligrams and we bumped me up to 20 milligrams. And that has completely reduced a lot of the hallucinations that I experience. It's made a significant difference in my well-being. And I'm also on an atypical antipsychotic, Vraylar. I'm on 3 milligrams. And, my symptoms are well managed. I'm, very stable. I've been stable for the past couple years, and being a mom while having schizophrenia, it's got its challenges. Like getting out of bed sometimes is hard, but you have to get out of bed with a child.
Let's talk about the management. So she described that escitalopram has really helped with her voices, and this has kind of convinced me of something I was thinking, and that is that she's probably having she's having two types of auditory hallucinations. She's having post-trauma auditory hallucinations and psychotic auditory hallucinations. And there's no reason you can't have both. And if you have a first-degree relative with schizophrenia, you're likely to get schizophrenia. And if you have your mother who has schizophrenia and a traumatic childhood, you're likely to get trauma and trauma voices. So it's interesting that actually normally an antipsychotic would really help with psychosis type voices, and an antidepressant can help with a kind of trauma or mood induced voices. And she's describing that actually the Lexapro, which is escitalopram, which is a selective serotonin reuptake inhibitor, which is one of the first line treatments for depression and anxiety and kind of mood symptoms, it helped. Bumping that from 5 milligrams to 20 milligrams helps with the voices. So that's very interesting. And I can imagine some psychiatrists would have tried to hit harder with antipsychotics, but that's great that didn't need a higher dose of antipsychotics, which can have, a lot of side effects. SSRIs also has side effects, but you've always got to think about the side effects of taking the medicine versus the side effects of not taking the medicine. So sometimes it's okay to, have a bit of sedation in the morning, hard to wake up, if it means that you're not having voices that are telling you horrible things. Anyway, the antipsychotic that she's on is called cariprazine. She calls it Vraylar. So we don't use that much here, but we should. It's a great antipsychotic. It's what's called a third generation antipsychotic, and it also has mood stabilizing properties, so it can help with that mood-induced voices. And it's a partial agonist of the D2 receptor. What does that mean? So in psychosis, let's just keep it simple for this video, but the thinking is that there's too much activity in these pathways in the brain that have a lot of dopamine receptors, the D2 receptors. And if those receptors are too hyperactive, getting too activated, then you get the symptoms of psychosis, the positive symptoms at least, the ones she's kind of described with paranoia and thought insertion withdrawals and voices. And if you put a partial agonist on them, which means it doesn't actually fully block them, it just turns the dial down halfway and stops them from ever getting to 100%. So it just blocks them from getting to 100% and keeps them at 50% maximum. If you put the partial agonist on them, you can have a really good response without all the side effects, or at least less side effects. So that's really interesting management, and I'm really glad that it's working for her. I wonder if, she's diagnosed with schizophrenia. I wonder if schizoaffective with depression as the mood component is another diagnosis to consider. And it wouldn't change anything. This is just intellectual, empirical speculation. But definitely she's got diagnosis of complex trauma and auditory hallucination. So anyway, interesting treatment. Let's keep going. I'm really stoked that she's at a place where she can talk about this, take good care of her bub, and that it's working for her.
If ands or buts about that, if he's crying, you have to do what he needs. So it's also taught me a lot about being accountable and being, a better person.
A lot of people talk about how having a child can, having something more important than them, having something to live for, really helps with meaning in life. And I just think that's wonderful. It can really help people become a better person to have a child. That's just great.
My personal belief is schizophrenia is fluid. You can experience all different types of schizophrenia within one person.
Interesting.
I've experienced paranoia, I've experienced apathy, I've experienced catatonia.
What is that?
Kind of just where you just stop caring about everything. You don't eat, you don't sleep, or all you do is sleep. You don't do hobbies, you don't listen to music anymore. You just, that's what happened to me in February of 2019 as I went catatonic in the hospital. And they actually wanted to put me in a larger institution because they didn't think that they could help me. But a friend reached out to me, and then that kind of sparked some life into me. So that's what
did the friend say?
If I wanted to go get smoothies while I was in the hospital, and I was like, yeah, I want to go get smoothies. I'm supposed to be being released today. And it turns out I wasn't being released. That was a lie. It was just to get me some hope.
What about that person?
Really interesting. Look, just to describe the terms. Okay, so I think what she was describing with apathy and anhedonia. So anhedonia and apathy, these are the symptoms where you just have a lack of interest, a lack of pleasure, an inability to get any sense of pleasure from things that you'd normally love. And it's one of the worst symptoms in all of medicine. Like, even if you get cancer, you still have hope and love and happiness in amongst the horribleness of cancer. But apathy and anhedonia it's one of the worst symptoms, because there is no drive, there is no motivation to have any response to anything. And you do become bedbound. Now, that is different to catatonia. And what she described, I don't know if that was catatonia. Catatonia is a set of physical symptoms where essentially people become completely wax-like. They become like a bloody sculpture, like a statue. There's no connection to the outside world. They don't see you. They can't respond normally to you, and it's weird symptoms. So my thinking is that the brain is so hyperactive that it's almost like a micro seizure. Like they're seizing inside their brain. They're not actually there's so much activity that the brain needs to be turned down in volume so that the healthy pathways can be heard. And what it looks like is someone who will just sit in a chair staring at the wall, not moving, motionless for 12 hours, until someone else moves them, and they would stay there longer. I've had patients catatonic and they'll stop eating and drinking for days, and it's life-threatening. It's absolutely an emergency. And so what you have to do is you have to go to hospital. The treatment is usually like benzodiazepines, which turn down that brain activity such that the healthy circuits can be heard again or focused upon again, and brings them back into reality. I've never seen catatonia treated with like a phone call to a friend, because that circuit, that social reciprocity circuit, cannot be heard or activated or focused upon, because there's just so much chaotic activity.
Reaching out and asking if you wanted to go for smoothies helped so much.
I felt alone. I felt like I was the only person in the world, and I felt like nothing mattered. So the fact that somebody cared and knew what I loved most, the smoothies, the fact that, they were willing to placate me with something that I enjoyed, even though I know that they didn't enjoy smoothies, was really uplifting. Prior to medication and therapy and all that, the visuals, I didn't understand. I would see shadow people, I would have night terrors, I'd wake up and I wouldn't understand what I was seeing, and it really caused me to be very hostile towards myself, because I felt like there was something wrong with me, and there wasn't anything really wrong with me, because this is something that happens to people and it's a naturally occurring condition. Yeah. So, I struggled with a lot of volatile behavior towards myself. Yeah.
This is something I'm personally learning a lot about as well, like balancing. Like sometimes I get emotions that I'm not like, that I repress. If I get angry with a patient or I don't know, whatever it is in personal life as well. If you feel emotions you're not happy about, like you're disappointed, you try and repress those emotions. Really, I think the thing is you're allowed to feel whatever you want to feel, but how you behave with those feelings is the focus point. Let your brain feel what it's going to feel, but your behavior, your response to the emotions is what you can control. And that's what CBT is all about. You identify the emotion or the cognition, the unhealthy kind of, thought process, and then you do the cognitive behavioral therapy to address how's that changing your behavior, how can you address the behavior to how can you apply logic or to the catastrophization that you're thinking or whatever. I'm getting on a tangent here, but you know what I mean? Like that's something I'm going through as well personally. It's interesting.
Do you want other people to know that you're diagnosed with schizophrenia?
I would like other people to know that. I have tried to be open about it in the past, and it kind of backfired in my face. I had some professional colleagues use it against me, and I was kind of pushed out of my position at a restaurant because I was open and honest about it. But to be fair, if I can help another person, I want to help another person, and I want to make sure that somebody else doesn't feel like they're alone. You're not alone. I experience it too. Prior to being diagnosed,
That's nice.
I had always had this large fear of the word schizophrenia, the idea of schizophrenia, and I was terrified of people with schizophrenia. Like, I always had that connection with schizophrenia. Like, I knew something was connecting me to it, but I was afraid of it.
When somebody hears your story, what do you hope they think?
I hope they think that schizophrenia isn't scary, that it's normal, happens to a lot of us, and it's naturally occurring. I hope that they think that I'm nice, that I'm approachable, and that I am there for them if they need me,
You seem nice and approachable to me.
Thanks.
Do you fear that people perceive schizophrenia as something that's scary?
Yes, I do. Yeah, because it's what Hollywood has portrayed it in the past through films and TV shows. Like, on Law and Order, the serial killer is a schizophrenic. Again, It's kind of like that thing. So it's like being perceived as
As I hope you all know, people with mental illness are much more likely to be the victims of crime than the perpetrators of crime, especially schizophrenia.
friendly. No fussing. Oh, I'm sorry.
Oh, you're fine.
It's very important to me to be perceived as friendly and open and honest and approachable.
Do you experience psychosis?
I do. I've experienced psychosis quite a bit growing up. And I've had 2 episodes in the past 10 years that put me in the hospital. Both times I was very sick and I really needed help and I really needed that guidance and that security of a hospital. Because the psychosis was so bad that I couldn't trust myself, I stopped taking all my medications. That's the first time I've ever done that. You know, I felt I was cured and I didn't need my medications, which is a lie. You always need your medications no matter what.
Sorry, this is hitting me right in the heart because this is half of my life. You know, the most, I don't know, you're like, medications kind of suck, right? But not taking medications just sucks more. And it's, you know, you've been dealt a really hard hand when you have schizophrenia. You've been dealt shit cards, but you can play the cards well. But to play those cards well, you need meds. And it's just so common that people stop taking meds because they think they don't need them anymore. And if you've only ever had one episode of psychosis, we actually do stop the meds after a year. We taper them down slowly with close observation because some people do just get one episode of psychosis. But if you get 2 episodes of psychosis, you know, and it gets very complicated when you get a lot of drug-induced psychosis over and over and over again. Then it's you know, if you're getting recurrent drug-induced psychosis, just call it, like, you might as well call it schizophrenia and treat it the same because it's going to happen again, and the treatment's the same. So anyway, it's so good that she's saying this. It's so good that she's spreading the word. I feel like I'm following a church leader now. It's great. Yes. Take your bloody meds. If you want to stop your meds, that's okay. You're not in trouble if you want to stop your meds. But talk to your doctor about how sensible that is and how to do it if you should try it.
And it really ruined quite a bit for me. It took me about 1.5 years up until I became pregnant to really recover from that episode of psychosis.
Sorry, I'm pausing so much. I'm so annoying. I'm sorry. Look, 2 things. First of all, the more times you stop meds and become psychotic, the harder it is to treat the recurrent psychotic. So the longer and higher doses you need of medications for the next psychosis. Let me say that again. The more times you become psychotic, the harder it is to treat, and so you usually need higher doses if you're having recurrent psychoses. The other thing is there are safe medications for psychosis in pregnancy. You know, I say safe, but there's nothing that's 100% safe. Being alive isn't 100% safe. You know, anyway, so during pregnancy, you have to compare the risk of not taking any medication versus the risk of taking medications, which are very low for mum and bub, depending on the medication. Some of them are very bad, and your doctor will know. But not taking medications if you have schizophrenia while you're pregnant, that's very risky.
Psychosis.
Psychosis is pretty much uncontrollable schizophrenia episodes or manic bipolar episodes. I mean, there's quite a bit of different conditions that fall under the term of psychosis. For me, it's experiencing hallucinations, experiencing exasperated negative symptoms of my schizophrenia, like the apathy, not caring what happens, not being accountable, and then just illusions of grandeur where I don't need my medications. And I know now that I will always need my medications.
Is the thought of not needing medications caused by the medications being effective and you felt good for so long and you think, well, I don't need these, I'm good?
Yeah, and it happens to so many people who live with schizophrenia and who live with other conditions. Because you feel good. So you're like, I don't need these anymore, but you feel good because it's regulating your brain chemistry and you've been regulated for a while and you're stable. So it's always important, no matter what, to take your medications. Learn from my mistake. I mean, it ruined me financially, it ruined my friendships, it ruined my friend circle, it caused some trauma to my own friends, and that's something that we're still working through.
Do you ever daydream about his future?
Yes,
Project into the future.
Yeah, and it's very, oh man, not good. Because I'm afraid he's going to inherit my schizophrenia like I inherited it from my mother. But who else better than me to guide him through schizophrenia, you know, if he does have it? I have to be stable for my baby. There's no ifs, ands, or buts about it, so there's a lot of pressure on me to notice symptoms of psychosis. There's a lot of pressure on me to reach out to my therapy team, my case manager, everything. if I'm even feeling a little bit depressed, you know, because I've got to be on top of everything now. My P's and Q's, they've got to be crossed, they've got to be checked, and I've got to be feeling the best that I can possibly feel to make sure that he's okay. And, you know, he's my number one priority.
Does your childhood trauma motivate you to be a great parent?
It does. Yeah, I want to break the cycle. I come from generational abuse. You okay? I come from generational trauma, and being a parent now, I don't want my child to ever experience not even a slight percentage, 0.001% of anything that I experienced.
Isn't this a beautiful side of humanity? You know, Abel, which is her name here, is talking about, you know, this inner drive that so many people have to break the cycle of trauma. And I see so many people with deeply traumatic backgrounds, and they do the best they can to break the cycle of trauma, and it's just inspiring, and I praise it. You know, it's so good. I love this side of humanity.
So I'm learning how to be a better parent. I'm going to college for early childhood education to learn how to be a better parent and to learn how to be a teacher, since that's always been a dream of mine.
Did you not feel loved and needed before having a child?
No, I didn't. I really didn't. You know, I had very obtuse parents and very obtuse family, and I had a long string of bad relationships that were very unhealthy. So I never really felt that until I had Dorian.
Did you not realize the relationships you had were unhealthy because that was your norm growing up with your parents?
Yeah. Yeah, and through a lot of therapy, I'm able to look at relationships a lot differently now.
What are your top priorities for Dorian?
I want him to be happy, because I didn't really have a happy childhood. I wasn't really happy until a couple years ago, and I just want him to experience what it is to be innocent.
You're in college right now?
Yeah.
Tell me about that.
Ooh, it's hard. It's so hard. I'm not used to it. I'm going to be 30, going into class with, a lot of younger people, and it's very alienating.
That's awesome, though. I think that's amazing.
Yeah.
That's so cool.
Thank you.
You're welcome.
It's a lot of fun because I get to put my reading skills to use and my writing skills to use, and it gives me something to do with my time. I work part-time so that I have a lot of free time, and it gives me something constructive to do, and setting goals, meeting those goals, very good for my mental health.
What are you studying?
Early childhood education. I'm currently going for an associate's in science, but then I'm going to go for a bachelor's in teaching and then a master's in teaching early education.
What drove you down that path?
Being a mom, and then realizing that I didn't know much about babies or their development or their brain, or how to properly communicate and relate and see problems from their side of their perspective, instead of just being the angry mom, like, stop having a tantrum. It's like, I want to understand the tantrum. I want to help him through the tantrum.
That is what attunement is. That is what is very important in the development of a healthy attachment style for a baby. Attunement, understanding why they're the way they are and expressing that back to them and helping them with what they need.
I'm not going to yell at him. I'm going to say, hey, what do you need? You need a hug? You need 5 minutes? What is it,
Do the medications completely eliminate your symptoms of schizophrenia?
They do now. Now that I
Wow.
started Lexapro. When I was just on Vraylar, I still experienced hallucinations, like audio and visual. I was still experiencing negative symptoms, but now that I'm on the Lexapro, that just works for my brain chemistry. It works perfect. It's a perfect combination, and it's taken me about 15 years to find the perfect combination of medications for myself, and I've never given up.
That's amazing. Look, a couple of points. She's saying negative symptoms. That's just the point around. We talked about the positive symptoms, which was the auditory, visual hallucinations. Visual hallucinations pretty uncommon in schizophrenia. This is quite unique. Usually it's more common in like drug use or dementias and things like that, which obviously she's not got. But those are the positive symptoms: the delusions, the paranoia, the hallucinations. The negative symptoms are the absence of normal things. So the absence of socializing, the anhedonia, the absence of pleasure, the absence of drive. Avolition is what that's called. And those are the symptoms that are really hard to treat. There's no great medicine for that. But I'm stoked that she got a response from the Lexapro, and it kind of tells me that maybe they weren't psychotically driven, but trauma and mood disorder driven. But, who knows? What she's saying is absolutely true. It takes years to find the right cocktail of medicines for someone's brain chemistry, and to get the right cocktail to get a good life, and hopefully fingers and toes and everything crossed that it lasts a long time. Sometimes you've got to touch things up a little bit, especially if there's stress in life, so nothing is forever, but this is a really good situation.
I mean, I've always wanted to experience life to the fullest, so it's going to take a while for somebody else to find the right medications. Like, the first medications you get put on probably won't work for you, and that's okay. You just try something else, and you got to give it...
30% of people will respond completely to the first round of medications, but that means that 70% of people won't, and of the 70% that won't, half have okay responses to the next. She's in the half that got an okay response to the second, third, fourth lines, and then the other half will never get like a really good response. And it's very surprising she's had a full recovery. That's quite rare in schizophrenia. Usually the way it expresses, the volume dial gets turned down. They can still hear mumbling or like radio static, but those are the voices that are so quiet that they're not like affecting their quality of life too much. That's what's most common, to have a partial response. But the goal is to turn that volume dial to a point where you can hardly hear the voices.
Time to really get into your brain and work its way through your body and your neurosynapses and everything, to get normalized on that medication. So it takes a couple months to get used to a new medication, and if it's not working out, then you just gotta wait, you gotta detox, and then you gotta go and try a couple more months on a new medication.
Patience is the rule.
It's worth it.
So what is it like to live your whole life with all of these symptoms and hallucinations, and then you find a medication that helps and eliminates those?
I can't even describe it. I mean, I finally feel healthy.
Wow.
I don't want to say normal, because there's no normal.
Well said.
Because everybody experiences brain chemistry different. I mean, everybody has a brain, and they're not doing brain transplants yet, so we all have to live with what we got. So being able to not experience voices yelling at me or trying to talk to me as I'm going to sleep, that's very liberating. And, I just feel the best I've ever felt in my entire life. I mean, this is what I have always dreamed about, and I finally feel like I get to live my life the way I want to live my life, now that I hold myself accountable as well, now that I have a baby.
Wow, there you go, guys. What a beautiful video. What a wonderful outcome for Abel. It's not every day that you see schizophrenia with such a good outcome. It's an interesting, I would say, dual or multi-diagnosis situation with the trauma and the schizophrenia, and they're very commonly seen together. And I'm just stoked that she never, I don't know if she never did, but it sounds like she didn't get too caught up in drugs and alcohol, so that's really good, because that's also a common comorbidity with these diagnoses, and I wish her and her bub Dorian the absolute best in their life. Dorian is an interesting name. I think it's the name of of JD from Scrubs. His name's Dorian, I think. And check out my Scrubs reactions. Anyway, it's a really nice video. If you enjoyed watching my reflections to it, please consider subscribing to the channel. Leave a like on the video. That's how the YouTube algorithm will reward it and show it to more people. And leave any comments of questions or links to other videos you want me to react to. Another massive shout out to the Special Books by Special Kids channel. Absolute game changer. They've got millions of subscribers, and they deserve it, because this is so wonderful to share these people's stories. And I'm stoked to be able to just reflect on them and help my learning as a doctor, hearing the people's stories. And it's always important to remember as a doctor that the real textbooks are the patients. The textbooks you read are just, a human's way of characterizing all the different patients. But at the end of the day, they're just schemas. They're just protocols and ways of characterizing what's in front of you. But what's in front of you is reality. That's just the way to interpret reality. So that's the real textbook here. So a massive thank you for Abel for having the bravery to share her story, and remember to keep taking your bloody meds. Okay. Lots of love, guys. I wish you a day full of love and joy, and I'll see you all in the next video. Bye for now.